It's been 3 years since voters passed Arizona's medical marijuana law. Now we've uncovered an alarming trend in who's getting these cards.
Morgan Lowe went undercover for tonight's hidden camera investigation.
I was unloading a truck and I was trying to push 3,000 pounds of batteries uphill, which didn't work, and I herniated discs.
Jay Fleming is one of thousands of Arizona residents who say medical marijuana has improved their quality of life.
I still use morphine for the low back pain, but I've reduced it by about half with the medical marijuana.
But new data from the state shows people like Fleming are becoming a minority. More and more young people are using the state's own program as a way to get their hands on pot. Our investigation started with a tip about a chiropractor in Scottsdale who would get us started. The seats in the waiting room filled with young men, ball caps, tattoos, and medical marijuana forms on their laps. I made the appointment complaining about a sore back, something I've really been experiencing since the beginning of the year. After a short wait, we walk into the exam room.
How long has this been going on for?
A couple months. Some days it's fine, and then it's sort of a dull ache. Is this something that I could get a medical marijuana card for?
Yeah.
Would that help?
Yeah, I mean, as far as it helping, I don't know. I mean, it could definitely, if you want. We could even give you a name of a place if you want.
That'd be great. A brief physical exam follows.
Is that tender at all?
No. Then a couple of cracks of my back, and we are done. $45 later, and they're sending my new medical records to a marijuana clinic. I just go over, I call them to make an appointment, or?
I told them you would be on your way and they'll be expecting you.
And that is where we head next.
When you have the pain, do you have more difficulty concentrating on things because of the pain?
I don't know. I mean, it's certainly distracting.
The doctor asks me a series of questions, then performs a physical exam.
On that side, it's where it's tight.
It feels tight.
Yeah.
Okay.
Which lasts 2 minutes and 5 seconds.
You are all set. I've got your form all filled out. So now the only thing left to do is to have your information uploaded to the state of Arizona.
The entire appointment lasted 9 minutes, and $150 later, I'm ready to send the forms she filled out. Those forms say I have severe and chronic pain due to lumbar dysfunction, associated myofasciitis, and something else I can't even pronounce. Back in the 5 Investigates office, I upload the information, pay another $150 to the state, and 2 weeks later, this comes in the mail. I went in complaining about back pain for a couple of months, possibly caused by riding horses when I was younger, and a migraine once a year. Does that sound like something that should have gotten me a card?
Well, let me start by saying I'm not a clinician, so I'm not a physician. But having said that, it doesn't sound to me like it meets the standard that we're asking for.
Will Humble is the director of the State Department of Health Services, which oversees the medical marijuana program, where 90% of the certifications are for severe and chronic pain, not cancer, AIDS, glaucoma, ALS, or any of the other specific illnesses that qualify someone for medical marijuana.
I realized, that severe and chronic pain had the potential to be the Trojan horse, whereby the recreational users would hook into and qualify for a qualified patient registration card.
Turn your body without moving your hips.
We invited the doctor we visited, Judith Jones, to sit down and talk about the process of getting a medical marijuana card. At this point, she did not know I had been her patient.
So I believe that this program this is a good program. I believe it does a lot of good for a lot of people.
Do you see patients and say, you really don't qualify?
There are some patients that will not qualify.
I came here and got a medical marijuana card.
Okay.
I had a sore back. Does that really qualify, a sore back, as severe and chronic pain?
That's subjective.
I never said severe. I was surprised that I got the recommendation from you.
Okay. Your pain is based on how you present to me.
I said it was about 3 months, and that when it gets bad, I can only run maybe 3 miles.
If you've had back pain for 3 months, I would say that is considered chronic.
And you attested that you saw 12 months of my medical records,
We have to have records within the last 12 months.
but not 12 months of medical records?
No.
It's very clear that we're asking the certifying physician to attest to the fact that they've looked at and have reviewed the patient's medical records going back 12 months from any other physicians.
The reality here is very different than what proponents have tried to communicate to the public.
Critics of the law, like County Attorney Bill Montgomery, say the loopholes are so wide, the program is experiencing a rapid increase in the number of young people. The state's own data shows the age group with the highest number of certifications is 18 to 30-year-old males. Nearly half of all recipients are now under the age of 40. Not the typical age range of the chronically ill, as Montgomery points out.
You can see the position that law enforcement officials and police officers out on the street are put in. Somebody's pulling out literally their get-out-of-jail-free card.
Legitimate medical marijuana users say they worry that people who abuse the law may ruin it for the people who need it.
In the past, it's been real difficult to get pain meds. I think it's just much better that I can go, to a friend, or I can grow my own medicine and take care of the pain, because most of the pain meds that they were giving me just weren't working.
The state officials we spoke to said it's the chronic pain condition that's allowing recreational users to slip through the cracks. But because this law was passed by the voters, it would require a vote of 3/4 of our state legislators to amend the law or to change it in any significant way.
Well, we have watched a significant debate erupt on social media today on our website, cbs5az.com. So just to clear up any questions for our viewers out there tonight, they want to know exactly how you did this investigation. So just to be clear, did you break any laws or misrepresent yourself in any way to get that card?
I did not. I used my real name, I described my real condition, and we worked with our attorneys to make sure we did not violate any laws.
All right, Morgan Lowe reporting tonight. Thank you so much.